Welcome, my dear students, to Chips and Game for Rats. The topic for the chart of the day is cancer cervix. Though I have labeled it as cancer cervix, you people should be wondering why so many subheadings are there facing us. So, I would like you people to kindly go through each one of them and pay enough attention, because each one can be a question on its own. They can come as slides, can be kept as charts, or sometimes specimens. So I would like you people to kindly follow the description that I'm giving in detail. Whenever we talk about cancer, there should be a precancerous lesion. Normally, it is a question for us and the students miss it. I would like you people to kindly take full advantage of the line diagram that is there on the screen, though I have given it elsewhere also. And it is dysplasia. The word dysplasia literally means disorderly proliferation. Now, what happens is, in the cervix, we have got a stratified squamous epithelium in the ectocervix and a glandular epithelium in the endocervix. Here, what I am seeing is the basal layer. And subsequently, I find that there are the different layers of epithelium which are developing. So this is normal. But when the atmosphere is not congenial, there can be changes called as dysplasia, which means again disorderly proliferation. And it is divided into three stages: stage 1, stage 2, and stage 3, depending on the thickness of the epithelium that is involved. So in this case, less than 1/3, I call it as stage 1. Less than 2/3, I call it as stage 2. Less than 3/3 or the full thickness, I call it as stage 3. And when the entire thickness is involved, it is called carcinoma in situ. This which people should be having in mind. And look at the cells, all the changes of dysplasia will be there. They are large, they are pleomorphic, nuclei are large, dark, hyperchromatic, irregular, and the relationship between the cells is lost. This is called loss of polarity. Further, there might be increased mitosis. In spite of all this, until the carcinoma in situ stage, you find that the basement membrane is intact. But after that, there is a breach in the basement membrane, and it is called microinvasion, later on a frank invasion. So this is dysplasia. You people can write this answer for general pathology, for neoplasia, and connote the same thing for respiratory pathology also. Now, I shall go to the gross description problem. So this is a specimen of the uterus and the cervix. I am not able to see the fundus of the uterus, that is not included in the picture, but then this is the cervix and this is cervical os or opening. And this is the ectocervix over here. And I find that there is a proliferating lesion that is coming out of the endocervix and involving a substantial part of the ectocervix. It is grayish white, irregular, somewhat proliferating or fungating. There are different types which you people should remember. Any lesion, I have told you earlier also, it can be ulcerative, it can be proliferative, or combine both. It can be ulceroproliferative. So this is the gross picture of it. And not all will be at the same stage. How do you stage the carcinoma of the cervix. This is staging of the cervix. Look at this diagram, a very beautiful line diagram. So this is the uterus, this is the uterine cavity, the uterine wall. The red line is the endometrium, and lower down it gets changed into the cervix. And this is the vagina over here. Initially, there is a very minute tumor, very difficult to find it. Probably when they paint it with iodine, etc., they might be able to locate. And it is limited to the lip of the cervix, not seen externally. So this can be one of the first stages of a cervical cancer. But later on, we find that it can infiltrate the wall of the cervix. Almost the entire thickness is getting involved. In this case, both the sides are being involved. So these are the B2 and B3 stages of the cervical cancer. Strangely, we find it can also spread along the endometrium in some cases where we will be confused whether it is an endometrial carcinoma or cervical carcinoma. So this is the next stage. I hope it is clear for you people. What happens next? After this, you find it goes beyond the female genital tract into the parametrium. Parametrium means it is the adjoining region. And we find it spills over into the parametrium or the gutter, which can be fibromuscular walled. So I am finding an irregular growth which is proliferating out of the uterus itself. And finally, there is a large growth which is proliferating and it is involving the parametrium. Here, the ureter is also getting involved and it is trying to ascend. Finally, you find that the entire pelvic cavity can be involved. Even today, I was reporting on a slide where the entire uterine cavity, the ovary, as well as the fallopian tubes have been replaced by tumor. So these are the stages. I would like you people to kindly recollect them. We had until now seen dysplasia, then the gross picture of the carcinoma of the cervix. What are the stages of the carcinoma cervix? Once there is gross, always it is followed by microscopy. Look at this one. I am finding multiple irregular glandular spaces. So what is the tumor made up of? Glands. So what is it? It is an adenocarcinoma. Adenoma means it is limited, no infiltration. Adenocarcinoma means it is irregular, it is infiltrating into the muscular region. So it is an adenocarcinoma over here. There are different types of it. We will not be going into it. Also, you find that I hope you people are able to identify this squamous epithelial pearls. Concentric arrangement, and then there is a hardness over here. These are called the epithelial pearls. So it is a squamous cell carcinoma, which we had seen earlier also in one of our descriptions. So remember these two things basically. And in the squamous cell carcinoma, there are two types. One is called keratinizing with epithelial pearls, non-keratinizing without epithelial pearls. They are again divided into small cell and large cell type, which you people can go and read. Now this is the advanced stage, fine. What do you do in the earlier stages? This is a routine test that can be done for diagnosing any of the cervical or the vaginal or sometimes even the endometrial abnormality. Here a speculum is used for widening the vaginal cavity, and then there is a cytobrush that is introduced with a spinning motion. It takes the cells off the surface. So this is called an exfoliative cytology. And finally, it is put into a media where it is fixed and smears are made after spinning. This is vividly described in exfoliative cytology. I would like you people to kindly read it up. This is an old friend of ours, a Y-shaped tube which is called the R.A.T.S spatula. So there is an endocervix and an ectocervix. This junction has to be covered. That is why the tube is Y-shaped. And look at the spinning motion. With this, they will be able to get the cells of the lips. Probably different spatula can be used for each of the lips. And similarly, smears are made. Now, what is the appearance of the cervical smear or the vaginal smear? These can be kept as charts for us or slides for us. Look at this fellow. I am finding large, pale pink cells with a dot-like or a hyperchromatic nuclei. These are called superficial cells. In the vaginal cytology, there are three types of cells. One is superficial, one is intermediate, and the third one is just above the base. We call it as parabasal. I repeat, superficial, intermediate, and parabasal. This is the intermediate cell, a bluish cytoplasm. Compare the nucleus, this is slightly larger. And finally, when there is too much of infection, you will be finding the parabasal cells. In this diagram, I am not having them. But fairly, I can appreciate the uniformity of the cells, so it is a benign smear. Background also is very clear. Now, in comparison with this, look at this smear. Here the cells are uniform. Here, obviously, they are varied. Variation in size, variation in shape, variation in the nuclear size. We all put together and call them pleomorphic. Added to this, there are some elongated cells which we call as tadpole cells. This is classical of a carcinoma of the cervix. So it is a malignant pap smear. So it is a malignant squamous cell carcinoma that we are seeing over here. Uniformity, no uniformity. Elongated cells, hyperchromatic nuclei. If we are not convinced, come to this one again. Again, compare. The best way of learning is comparison. Here, the cells are uniform. Here, I am finding that the size is varied. This is the nucleus. This is the cytoplasm. Size of the cell is different. The nucleus is different. They are hyperchromatic. Look at this. It is having a flower-like outline. And an elongated cell, a classical tadpole cell that I said. So this is a malignant smear. This particular smear, I would very much appreciate if you can draw in your records or otherwise. Having said that, this is a very important line diagram. Concentrate only on this because we have already seen the histology of it. Initially, I find the benign cells. Later on, there is a slight pleomorphism in the basal 1/3 and it is in the middle 1/3 also. So it becomes larger. And finally, the entire thickness is involved, which we call a cervical intraepithelial neoplasia grade 3. The uppermost layer can be spat. When that is also involved, we call it carcinoma in situ. So this is a beautiful line diagram, very simple for us to draw. We had seen all these things. The mode of collection, the normal smear, the abnormal smear, and the dysplastic cells. What else is left? Our age-old friend, the metaplasia. What is metaplasia? So this is again an examination slide for you people. See what is happening. This is the endocervical epithelium. This is the endocervix. It is bending. But suddenly it is getting replaced by large polygonal cells. Our classical friend, the squamous epithelium. So it is a squamous metaplasia. Metaplasia is the replacement of one adult type of tissue or cell by another due to varied differentiation of the basal cells. So this is the basal cell. Similarly, there will be the basal layer here. It gets differentiated into squamous cells. It is called squamous metaplasia. So this is, you will have to draw this diagram. If you people find it difficult, just see this. This is the columnar epithelium. It is getting replaced by the stratified squamous epithelium, which is a squamous metaplasia. This is a superb line diagram which you people must draw, taken from Robbins in your examination. So I find that there is the ciliated epithelium is for the respiratory, but we can make use of it. It is being replaced by the squamous epithelium. So it is a case of squamous metaplasia. It can happen in the respiratory epithelium as well as in the cervical epithelium. So the references for you people will be the R.A.T.S. I have very vividly dealt with the carcinoma cervix as well as metaplasia, dysplasia, everything in R.A.T.S, tips and game. Kindly go and search for them, and our anchor shall remain to be problems. So in today's class, we have seen that there is a plethora of changes in carcinoma cervix. We'll have to talk about dysplasia, the grading of dysplasia, carcinoma, and situ. What is the gross picture of carcinoma of the cervix? What is the microscopic picture over here? And what is a pap smear, which is a question for us. And here I am finding the brush cytology or an IR spatula being used for getting the benign cells and the malignant cells. The grading of the dysplasia. Incidentally, before I complete, the pap smear can be used for studying the Candida albicans, or it can be used for studying Trichomonas vaginalis, any form of metaplasia, atrophic smear, hormonal status, etc. This again I have given very vividly in my topic on exfoliative cytology, which is a university question for. And here, of course, is the metaplasia. This alone is not sufficient. There are other types which I have mentioned. Kindly go back to them. And thank you for your patience.